When you talk about family history, just how important is that when we look at cancer? Hello everyone, I'm Joe Basichia along with Dr. Rachel Levenbach. She's a hematologist and medical oncologist at Virtua. Good to see you, Doc.
Hi.
It's something I know all the doctors will always ask, what's your medical history? It does matter.
So family history is very important in cancer because in patients who have a strong family history of cancer, we recommend different screening as opposed to just the recommended screening for the routine population. So it is always important to tell your doctor about a family history of different cancers that you have.
Now, I guess the most important message that we can have out here with this is we're not talking about fear. We're actually talking about, okay, what can you do about it before anything develops instead of burying your head in the sand?
Yes, so it is the reason that we like to detect cancers early or know about the family history is because we do have ways to decrease the risk of patients developing invasive cancers, as opposed to a long time ago where we would know about this, but we weren't able to necessarily treat it. But in breast cancer and in other cancers, we are able to do early prevention to decrease the risk of patients developing invasive disease.
Dr. Levenbach, we've come so far and are going to great places when it comes to cancer care. People should certainly use all the resources in front of them, shouldn't they?
Yes, so it's important to know about a family history because, for example, in patients with a strong history of colon cancer, then not only will we do a screening colonoscopy at 50 years old, but sometimes patients will be getting colonoscopies earlier depending on when their family member was diagnosed. As well as patients who have a strong family history of breast cancer, not only will we do screening mammograms, but we will also do screening MRIs and sometimes put patients on a certain medication that will decrease their risk of developing invasive breast cancer.
And is there any age, by the way, that you should start looking at such things?
Really, patients of all ages, we want to know about a strong family history because depending on the type of cancer and the family history, this will determine when we'll start the screening.
Dr. Rachel Levenbach, she's a hematologist and medical oncologist at Virtua. Thank you for being with us. And if you'd like to learn more about Dr. Levenbach or any of our Virtua physicians, simply go to virtua.org.